Hey there, John Ferriman here from Balanced Physical Therapy. What do getting your providers to do things that are difficult, living a long life, and your anterior mid-cingulate cortex have in common? Well, if you don't know immediately right off the bat, let me help you explain. How many of you have had trouble as founders, leaders, creators, owners, directors, clinical directors, residency directors, have had trouble getting some of your providers to see the patients that you need them to see more difficult patients, to see more patients, to build the right units, to learn a new technique, to greet patients a certain way in clinic, to become a part of your culture and your ethos and your ecosystem, just because they don't want to or they don't think they can? You know, how many of you have heard, I just can't, it's too hard, why, from your providers? If that sounds familiar, even just a little bit, let me help you. Ask them if they want to live a long life. Now you're going, what? Yeah, ask them if they want to live a long time. And when they say, well, of course I do. Say, well, then why aren't you stretching out of your comfort zone? Why aren't you learning new techniques? Why aren't you going to more courses? Why aren't you hitting your metrics? Why aren't you asking more questions? Why aren't you practicing the way that our company expects you to practice here with our set of core values? And when they look confused, ask them if they know what the anterior mid-cingulate cortex is. And as physical therapists, most of them should know, that little structure deep in the frontal lobe that has to do with willpower, that has to do with grit, that has to do with doing hard things, that part of our brain that actually grows when we do things that we don't want to do. For example, we all like ice cream, right? I like ice cream, but when you say no, because you've had a little bit too much, guess what? The anterior mid-cingulate cortex grows, but when you give in, it contracts. People that don't get out of their comfort zone, people who are always seeking comfort, actually have a contraction in that part of their brain. It actually gets smaller. Athletes who train regularly, people who overcome adversity, people who get through really hard times, the anterior mid-cingulate cortex grows. Maybe it's the will to live. Maybe it's the key to unlocking a better, longer, healthier life. Who knows? But if you have providers that are resistant to doing hard things, talk to them about this. Tell them they're going to live longer. They're going to do better. They're going to actually become more. And after all, as professionals, isn't that what we're after? To be paid for who we become, not for what we're doing. So I know it's a stretch and some of you are going, I don't know about that, but give it a shot. Seriously. For those of us who come through adversity, for those of us who train regularly, for those of us who put ourselves through mental and physical anguish and do hard things on a regular basis, that portion of our cortex is actually larger. Give it a shot, try it on, do the research yourself. Don't take my word for it. But it is a way to build resilience and grit in yourself and in your teams. Try it on. Thanks for listening.